remind people that we are recording the presentation. I'm gonna start letting people in. Hello, everyone. Thank you for joining us. Hopefully you are at the right place. This is the Communities Count, our Communities of Opportunity, Racism as a Public Health Crisis, What is the Role of Data workshop. And we'll be getting started shortly. We'll get started in a couple minutes. Just gonna give folks some time to join us. Again, hi everyone. Thank you for joining us. If you want to maybe take a few moments to introduce yourself in the chat box. So name, your pronouns, and then the organization that you are representing today, that'd be great. We'll get started in a couple minutes. We're going to give people a couple more minutes to join us here, but thank you for being here today. Great. So we're going to go ahead and get started. Thank you again for joining us. Hopefully, like as I mentioned, you're at the right place. This is the Communities Count and Communities of Opportunity Learning Community Racism as a Public Health Crisis. What is the role of data workshop? And I'm joined here today by my lovely colleagues. We'll start introduction. So we'll start with Sarah J.
Hi, everyone. My name is Sarah J. I use she, her pronouns. I'm an epidemiologist at the health department, and I work with our wonderful team here on Communities Count, as well as with Best Starts for Kids. I'll pass it along to Joey.
Hi, everybody. My name's Joy McCracken, and I use she, her pronouns, and I'm a project manager in the Assessment Policy Development and Evaluation Unit of Public Health Seattle King County, and I provide just general project management and administrative support to the Communities Count team. And with that, I will pass it on to Mariko.
Hi there, I'm Mariko Toyoji. I use she, her pronouns, and I'm also an epidemiologist with the Assessment Policy Development and Evaluation team, where I work on communities count and doing a lot of our work with data visualization and interpretation, as well as supporting these great workshops. So, I'll pass it over to Vanessa.
Thank you. Hi, everyone. My name is Vanessa Quince. I am a social research scientist for APDE, Assessment Policy Development and Evaluation Unit. I use she, her pronouns. And in addition to my work with Communities Count, I am the lead evaluator for King County Zero Youth Detention Initiative. And with that, I will pass it to Hani.
Hello, everyone. My name is Hani Mohammed. I'm a program manager also on the Assessment Policy Development and Evaluation team here at Public Health Seattle King County, doing, of course, supporting these amazing folks here that I work with, as well as some of our community engagement strategies and work. And I wanted to give Wendy also an opportunity to introduce herself as well.
Hi there, my name is Wendy Chang. I'm from Cascadia Consulting Group, and I'm supporting this event. Thank you all for joining us today.
Great, thanks, Wendy. So yeah, if you're just joining us, please be sure to continue introducing yourself in the chat box. Again, name, preferred pronouns, and then the organization that you are representing today. And then Wendy, are we sharing the slides? Should we start sharing the slides? Awesome, thank you. So we'll go to the next slide, please. We want to start off, of course, with land acknowledgement. So we gather here today on the ancestral land of the first people of Seattle, the Duwamish people. We honor, of course, with gratitude the land itself, the Duwamish tribe, and all Native people who call King County home. So this acknowledgement is really just a small step against the erasure of our Native communities. In addition to the Duwamish, King County is home to the traditional lands of the Muckleshoot, Snoqualmie, Tulalip tribes, and other Coast Salish people. Today, King County is home to a vibrant and diverse community of Indigenous people from across North America and beyond. And so for some helpful tips to continue to supporting our Indigenous and Native people and communities, please visit the realrentduwamish.org to continue to support. Next slide, please. So this workshop is, of course, sponsored and supported by the Communities of Opportunity Learning Community. So COO is a public-private community initiative funded by King County through Best Starts for Kids, as well as the Seattle Foundation, that works through community-driven partnerships to create racial, economic, and health equity so that all youth, families, and communities in King County thrive and prosper. The COO learning community leverages the power of collective knowledge to accelerate change, focusing on providing resources for shared learning opportunities, building critical connections, supporting capacity building, and the creation of equity tools, models, and conditions that actualize the thriving communities we envision. And so for more information about this, partnership, please visit the website you see here at coopartnerships.org. Next slide, please. So for quick meeting terms, we wanted to let you all know that, of course, kids, pets, and sweats are okay. We want you to be as comfortable as possible during this workshop. I think we'll hopefully be together for 90 minutes. And so please take care of yourself, take a break with especially with the topics that we'll be discussing. I think self-care is really important, so please be sure to engage in that. We would love to see your faces, so if you want to come off camera, we would love to hear from you, but it's really whatever you're comfortable with. Of course, continue to engage with us through the chat box, as we'll be monitoring that. Just a reminder to continue to respect the experiences and the perspectives that people, including the presenters, will be sharing. And again, it's really optional to introduce yourself in the chat, but we'd love to know who's all here today, and we'd love to just be able to hear from you. One more thing is we are indeed going to be recording this, but we'll make sure that any sort of interactions that we have with you all will not be included in that recording. We're really just focusing on making sure that we're recording content so that we could share this with more folks. So. And next we'll be administering a poll, a couple of polls actually, just to sort of see how you all are doing, see how you're feeling today. So if you all can engage in those polls, that'd be great. We'll take a couple of moments to do that. Great, thank you everyone. I'm seeing a lot of feeling like warm sunshine days, which is really good. I'm seeing a little bit of a little drizzle, you know, a rainy day, and that's okay too. But thank you all for taking a moment and sharing that with us. Next slide, please. So this presentation will cover some elements related to socioeconomic factors, physical environment, health behaviors, and overall health care. It's also important to note that policies, equity, justice, and programs all impact an individual's experience and access to these resources as well. And so this is a real fun image that we just wanted to share with you all that sort of represent how these different factors contribute to one's overall health and well-being. Next slide, please. So just for an introduction and sort of framing of this presentation or workshop, and where some of the policies and causes that we'll be sharing with you all are sort of coming from, is really understanding the oppressive systems and racism that continue to create disparities in access to services, both in education, economic attainment, and life expectancies for communities of color. In 2019, COVID-19 really intensified this and put a spotlight to highlight how communities of color are disproportionately impacted by COVID-19, which are often driven by other underlying conditions and disparities. This includes the degree to which communities of color experience higher rates of underlying health conditions which are likely to have to do with the lack of access to quality healthcare. So this presentation will highlight different snapshots across a lifetime, including infant mortality, food insecurity, unemployment, economic stability, and life expectancy, as well as policies that really and causes that really impact each of these. Though we know that in reality, policies and discrimination, systematic racism, and access to these services do not occur in isolated moments, but rather occur dynamically and often simultaneously throughout the entire lifespan of and across generations. And so that's sort of the framework that we wanted to share with you all here. Next slide.
Thank you, Hani. So before we go into some background context around the role of data, we just want to have another poll. So Wendy, if you wouldn't mind launching the poll, just so we can gauge how you use data within your organizations. So from responses, I'm seeing a lot of program planning, a lot of community engagement, organizing, quality improvement, and then a couple of responses looking to get started. And I think it's like okay to be at different levels. Definitely later on when we engage in the breakout room activity, keep these in mind because we're going to be asking you like, how do you think that you can make like data more equitable in the work that you're doing within your organizations as well. So just to provide a broader context in terms of like why we're engaging in this conversation and what about the role of data. So we see this conversation as part of this never-ending feedback process where data collection and dissemination changes and are informed as a result of community engagement. Part of how we've structured this presentation is very much in response to community feedback saying that when we're presenting data or talking about data, be mindful of the historical context, as well as highlighting some policies, practices, and procedures that can map on and help us to understand some of the health inequities we see, instead of just focusing on the individual and creating a negative narration around the individual. So why does data look the way that it does? Actually, it's legislated in policy, right? So we have the Office of Management and Budget, OMD, that has the definition of 5 race and ethnic categories. And we know that these 5 categories do not reflect the variety of diverse racial and ethnic groups within King County at large. And we hear a lot from community members that these 5 categories, if we just leave these 5 categories as is, it masks some of the differences that we see within King County and doesn't necessarily reflect the different experiences of the groups within this region. So as you can see in the top frame, you have data collection, you have policies and community engagement. So it's this constant like feedback loop and process itself. So policies impact data collection, and then data collection impacts the policies. So this is constantly happening. Community engagement, how we translate and interpret information, and outreach are important pieces of this cycle as we continue to move this conversation forward. Next slide, please. So once again, this is very much at part of this overall data cycle. We don't see data as this like static thing that happens at one period of time. It's this constant process. In the middle of the process, you have community voice and engagement, and that should be informing how we collect the data in the first place, how we analyze the data, and how we disseminate the data. Outside of that, you have policies that are going to be informing those as well, translation and interpretation, not leaving data to speak for itself, but allowing some context around that, and making sure how we disseminate and how we share that information actually maps on and relates to the communities that we're highlighting. Programs, what are these programs and how they fit into that? And then equity and justice. So once again, don't mean to beat the nail on the head, but this is a constantly iterative process for us to move a step forward in understanding the role of data in addressing racism as a public health issue, public health crisis. Next slide, please. So we want to make sure that we show that we have been taking steps to understand, to kind of reflect what's going on in communities. So here are some examples of the steps that us as a team on Communities Count, but larger within APDE, these are some of the steps that we're taking. So first, in conjunction and in collaboration with Communities of Opportunity, the learning cohort, we are providing technical assistance for community-led data collection to highlight community stories. So basically, very much Communities Count, we're taking a step back and just providing technical assistance as the grantee organizations tell the stories about how COVID-19 is impacting their communities. Next, whenever we have the chance to collect data that is disaggregated by more specific racial and ethnic identities, we strive to do that. So one example is the Best Starts for Kids health survey. So remember I said that the 5 racial and ethnic categories kind of mask some of the differences. We're going into disaggregation by looking closer into certain Native Hawaiian Pacific Islander communities, as well as African American or Black communities within King County. So examples would include Samoan, Ethiopian, Cambodian, and Mexican. So we can make sure that we're highlighting the experiences that they're facing. We also have disaggregated data in the Healthy Youth Surveys, specifically the Asian category. So making sure that we're understanding and highlighting the nuances within that. We're also hearing a lot that quantitative data only tells a snapshot of the story. We as APDE, we're highlighting in more qualitative data collection. So this includes the Youth and Young Adult Gun Violence Report, where we did 14 listening sessions, as well as 10 key informant interviews to understand the perspectives of youth, young adults, and their families who who engage in gun violence. We also have the LGBTQ Spotlight Report. So each year, the health department releases the Community Health Needs Assessment, which is a quantitative analysis of the health of the community at large. To complement that, we kind of highlight and focus on a specific population to kind of speak to some of their experiences that aren't necessarily captured by the quantitative data. And then if we're thinking about the role of racism, trying to capture data that actually shows and highlights the experiences that communities are having, we've added an additional question about racial discrimination to the statewide behavioral risk factor surveillance system to understand what are the different ways that communities are experiencing racism and how might we be able to address that. Next slide, please.
All right, we are going to take a look at some examples of data that that were used to show just what a crisis racism is for public health. But before we get into that, I saw there was a question in the chat, which I want to address. How is community defined in this presentation? That is a really good question. Community is one of those words that is used a lot, and it can mean many different things. And I would say that in this presentation, it doesn't necessarily always only mean one thing. But thinking of some of the examples that Vanessa just shared for things like the communities of opportunity, community-led data collection that's happening, we are partnering with funding 5 different organizations that are led by and reflective of the communities that they serve to develop, plan, and do their own data collection to tell the stories of how COVID is impacting their communities. And then in other examples, we are connecting directly with community members like parents or young people to hear directly from them about things like as LGBTQ young people, what have their healthcare experiences been? Or as young people impacted by gun violence, what has their experiences been? So that's a very good question. Again, what that actually means can be really different. And depending on your project might look really different. And again, before we dive into the data, I wonder if any of my co-presenters also would want to chime in on that. If not, we can start taking a look at some of the data. We're going to be looking at a few different pieces of data that speak to different aspects of health and well-being, as well as Hani described, all those different kind of lifetime social and economic aspects of life that have a huge impact on public health. So we'll start at the beginning with infant mortality. And this is such an important reflection of the health and well-being of a community. Often if you're just going to pick one or two numbers to reflect how well a community is doing, it would often just be infant mortality and life expectancy. And we see huge inequities here in King County, as well as throughout the country, on infant mortality. What this chart is showing is for every 1,000 babies born to a mother of each of these racial and ethnic groups, how many babies pass away within their first year of life. So for example, for American Indian and Alaska Native mothers, 13.4 babies per 1,000 born. Yeah, sorry, distracted by the chat. Mariel will drop a link to that momentarily. This is way over twice, in fact, over 3 times the rate for King County average. And for babies born to Black mothers, again, we see over twice the rate of King County average, 8.3 per 1,000 babies. Can we go to the next slide? Now, as I said, so many things impact infant mortality. And, you know, some of the things that you might guess that are really straightforward, like access to prenatal care, access to quality nutrition, access to a safe and healthy living space that impact infant mortality, all of those things can be impacted by racial and systemic oppression. But we know that even above and beyond those kind of specific risk factors, the lifetime experiences of racial discrimination and systemic oppression also take a toll, even on top of those, you know, things like nutrition and healthcare access. So as you can imagine, many policies contribute to these inequities, but just a couple that, you know, kind of help make it concrete include access to healthcare, especially prenatal and perinatal care for parents and babies, and paid family leave to care for newborns. Next slide.
Thanks for that introduction, Sarah J. And we're going to go into talking a bit about some of the data we have on basic needs. And one of those is housing stability, which is a really important part of health and well-being. And a key part of that is housing affordability. And so one of those indicators we use to monitor and look at that is housing cost burden. So those are households that pay over 30% of their income on housing. And locally, from the data, we can see here that communities of color in King County experience rates of housing cost burden at rates that are higher than white residents. And Black and Latino households experience some of the highest rates in the county. And it's important to know when we look at these data that inequities in housing affordability are rooted in longstanding policies, and those stretch back to those relating to lending practices, wealth accumulation, and access to resources. And this is just one indicator of many. And we also see local racial disparities in other areas, such as homeownership rates among whites in King County are more than twice that of Black residents. And also, when we're thinking about stability, evictions are particularly worrisome, and Black adults are evicted at more than 5 times the rate of white adults, and Latino adults were evicted more than twice as often as white adults locally here. So the data point to some really, really large disparities and inequities that we see here by race. Next slide, please. So there are many contributors to housing disparities, but some of the major ones can be traced back to redlining and other racist real estate practices. And these practices define areas that were ideal for banks to invest and sell mortgages in. And these policies were combined with racial restrictive covenants that prohibited people of color from buying, renting, or even just living in certain neighborhoods for decades. And these policies had lasting ramifications to the present day. As we look more currently, zoning policies have largely centered the interests of wealthy white homeowners historically and have also exacerbated some disparities and contribute to our current affordable housing crisis. And inequities in health and access to houses, condos, and apartments still take place to this very day through combined practices of credit rating agencies, lenders, and the real estate industry practices that we often see today. Next slide, please. So safe, stable, and affordable housing is a key contributor to health and well-being, but over generations, barriers to home ownership has led to extreme wealth gaps by race, reducing financial security and housing stability for many communities of color. Also, lack of affordable housing and evictions can put people in a cycle of housing instability, making it more difficult for people to find affordable housing in a already very competitive and challenging housing environment that we have locally. Additionally, the longer term divestment in segregated neighborhoods has led to communities of color as a whole to have less access to resources and services than white communities, which have further exacerbated many health inequities that we see locally too. Next slide, please. So as disparities continue with just meeting basic needs, and one of those most basic needs is food. And so here we're looking at data that shows local food insecurity. And so here we see disparities by race, and many adults, particularly Black and Hispanic Latino adults, have very high rates of food insecurity. And that's defined here as running out of food within the last month without the ability to purchase more. So one of the things that we know is that food insecurity puts people in situations where they often have to choose between other needs to help meet those. And so food security is very, very important. And these data have often really, really surprised me to see such a stark difference, seeing rates that are 4 times as high for some communities of color when we compare to white adults or even the county average. Next slide, please. So I want us to be clear that food security in our society and food insecurity, in our society is not caused by insufficient food, but rather the inequities that disproportionately impact communities of color. And so disparities in meeting basic needs are linked back to systemic issues. And really those are rooted and create differential opportunities for living wages and conditions for economic stability too. And so while food insecurity has many consequences across the lifespan, it's particularly impactful in the long-term health and development of children and families. Older adults as well are particularly vulnerable to food insecurity. There's many assistance programs such as SNAP and WIC, which can help mitigate impacts of food insecurity, but eligibility policies, documentation requirements, and impact of public charge can create barriers for many experiencing food insecurities to get access to the assistance they may need. Food deserts, which are areas with limited access to affordable, nutritious foods, are also disproportionately, disproportionately impact communities of color. And what they do is they create even more geographic and economic barriers to people getting consistent access to sufficient food that they need to support their health. It should also be noted too that food deserts and diabetes rates, there's been studies that show that they also go hand in hand. So food is not only important just to keep our energy, but also to really sustain good health for under many conditions. Next slide, please. So consistent access to affordable food is essential for individuals and families to support health. There's systemic barriers that create inequities in meeting basic needs such as food, but also create situations where people are having to choose between things like critical medical care, housing, or transportation. And these can also further exacerbate health disparities or challenges. And while Food and nutrition support programs are a place to start. Other systemic changes and supports are needed to create equitable food access that can provide nourishing, affordable, and culturally relevant food for our community to support health. Next slide, please.
Great, thank you so much, Mariko. So far we've sort of discussed the role of data and how policies contribute to various inequities. We've sort of gone over these examples of how these barriers are directly impacted and are a direct result of certain policies and continue to be, right? Even within employment or unemployment. And so we know that with employment, it's directly linked within individuals and families' ability to afford certain necessities, have access to certain benefits, and of course generate sort of overall economic security. Here in King County, as you can see here, American Indian, Alaska Natives, Black African American, Native Hawaiian Pacific Islander, and Hispanics or Latinx are more likely to be unemployed compared to white adults, as well as the King County average. Next slide, please. So we know that individuals in BIPOC communities are more likely to have several sort of low-paying jobs at once. And these are due to sort of greater inequities at hand and greater power structures at hand. And so this sort of results to less job security within these types of jobs. And with less job security, there's also a likelihood that these types of jobs are the first hit when it comes to any sort of economic downfall that we might experience. There are, of course, benefits associated with full-time employment that communities might not have access to if they are experiencing unemployment. And so these long-term or sort of long-term benefits would include retirement and, of course, healthcare, which really contribute to the long-term economic stability. There were direct policies, even at one point, that barred BIPOC communities from certain job sectors. So historically, trade unions didn't really allow for those of different racial and ethnic backgrounds to join those sectors. We also understand that within the racial wealth gap in the United States, there is a disparity in median wealth between the various different races and ethnicities. With white households continuing to see an increase in wealth, and while BIPOC households and communities continue to see this decrease. Next slide, please. There are also disparities that exist in the money that people have saved to pay bills while unemployed, and these disparities continue to sort of amplify. There is more of a difference in how much families make rather than, there's more of a difference in how much families have and save rather than how much they make. And this is all dependent on one's race, racial and ethnic background. How an individual worker or a family makes it through unemployment also depends on how much they can fall back on. And these fallback funds are only available and are dependent on some of the factors that we've just mentioned. And then now I'm going to turn it over to Vanessa to continue talking about economic security.
Thank you, Hani. So not only does there exist disparities in terms of unemployment, but the overall larger context of income too. So this figure shows the median household income across racial and ethnic groups in King County. This graph doesn't show the average, but the King County average is $94,000 a year. Lower levels of income make it harder for communities to support their basic needs, but then also save for the future should an emergency happen. We see that across racial and ethnic groups, Black and Hispanic residents have the lowest median income with about $50,000 to $66,000 each year, respectively. Next slide, please. So median household income is closely tied to employment. So this figure might be large to see, but it might be difficult to see, but it's the average annual wages across different sectors by race. And we can see that across each of these sectors, accommodation and food services, retail, healthcare, social assistance, construction and manufacturing, BIPOC communities are consistently paid lower than white residents and lower than the sector average. If you take a closer look at the figure, the green dot is the sector average, and we can see that BIPOC communities continue to receive lower wages than the sector average. These disparities are also further compounded by gender, where the US Bureau of Labor Statistics finds that white men with some college or associate's degrees earn more money than Black and Hispanic women with bachelor's degrees. If we think about the fact that BIPOC communities are more likely to take out loans, this further intensifies some of the inequities when going to college means that you might get less money, but then you still have loans that make it difficult to continue to generate wealth for the future. Next slide, please. What are some causes and policies for economic security? BIPOC communities are disproportionately represented in service, domestic, caregiving, as well as agricultural jobs, which have been systematically undervalued and undercompensated. Furthermore, systems involvement, and by systems involvement, I mean engagement with the criminal legal system, as well as immigration status, may further keep communities out of higher paying jobs. Even when communities of color are able to break through barriers to get through higher paying jobs, there still exist barriers to entries. Regardless of job title, industry, location, minority applicants were much less likely to report receiving an employee referral than their Caucasian counterparts. So within different industries, we see that there are also barriers to entry, and it creates conditions where BIPOC communities are condensed in certain fields rather than others. Next slide, please. Additional examples of systemic practices include redlining, as well as discriminatory labor protections and conditions. In King County, the higher percentages of Black individuals are living near poverty or living in poverty when compared to white individuals, and these different inequities lead to increased levels of chronic stress and anxiety throughout the lifespan. Next slide, please. So now thinking about all of these different systems and all of these policies. So this figure shows the life expectancy of different communities across King County. The King County average is 81 years, and that's comparable to the white rate, which is also 81 years as well. And I want to make sure that we're not just focusing on deficit-based and strength-based. We can see that Asian and Hispanic communities, they live longer than the average King County resident. So maybe that lends itself to thinking about, like, what are some of the reasons underlying the fact that although these communities are still experiencing a lot of inequities, they're able to live longer, and trying to understand, like, what explains those relationships that we're seeing. However, we do see that Black, Native, Hawaiian Pacific Islander, American Indian, Alaska Native residents, they have a lower life expectancy when compared to the King County average, but also white residents in King County. Next slide, please. So what does this look like, right? So the chronic stress that accumulates over a lifetime for BIPOC individuals results from generational and lifetime experiences of racial discrimination. What we're trying to do here, we're not trying to isolate one thing over another, but look at the context. So from infancy, the way that we started this presentation, to all of these different barriers. So you have food insecurity, education, healthcare. How do these different and chronic stressors map onto life expectancy and the experiences of BIPOC communities throughout King County? And now I will pass it on to Joey to introduce our activity.
Thank you so much, Vanessa, and the rest of my Communities Count colleagues. So up until this point, we've looked at data and how various policies and underlying factors impact health, social, and economic inequities for communities of color in King County. Specifically, we've looked at infant mortality, housing, food insecurity, unemployment, and economic security, as well as life expectancy as that kind of culminating experience for many of our communities in King County. So we're going to shift gears a little bit now, and we'd like to invite all of you to engage in a discussion about the role of data in declaring racism as a public health crisis. And to provide a little bit of context and background, we actually presented a similar presentation. It had a little bit of different topic areas included, but the same kind of policies and systems lens at different health and social and economic inequities. And at the end of that presentation at the Best Starts for Kids Summit, we actually asked participants to provide feedback and ideas on 4 different questions that we posed at the time. So the questions that we had posed was, number 1, how can we change the legacy of data being used against communities? Number 2, how can data help address and highlight racism? Number 3, what additional data, tools, or resources do you wish you had to address the impacts of racism? And then finally, what does data justice look like to you? So based on responses and ideas that we heard back from participants, we actually summarized all of those responses by 5 different themes. And you'll see those 5 different themes in those 5 boxes across the screen on this slide. And we've actually separated those themes into 5 different breakout rooms, and we're going to invite you to join any breakout room that you are most interested in having a discussion about. But before we do that, I wanted to share just a little bit of information about each of these themes. So for breakout room session 1, it will focus on the theme of community-based participatory research and really increasing community participation in all parts of the data collection process. And that includes even before data is collected, so really in that planning phase, as well as afterwards when you're thinking about interpretation, dissemination, and really understanding the results. The second theme that we heard from participants around data justice is going to be the focus of breakout room session 2 on really approaches to data collection. So really being intentionally more inclusive of different data collection approaches and methods. And by that, we also mean really valuing community knowledge and holding that in the center at the same level as academic rigor. The third breakout room is focusing on how institutions should be more transparent about their data collection processes and the biases that underlie the data. Breakout room 4 will focus on the general research agenda. So really supporting the use of data for anti-racist change in policies, processes, and practices within institutions, and then really engaging and supporting communities in co-creating and shaping what those policies look like. Breakout room 5 will focus on representation. So really recruiting and supporting Black, Indigenous, and people of color as researchers. And within that theme, really investing in data and evaluation trainings, as well as professional development of BIPOC researchers. So in terms of the overall format, again, as I mentioned before, you'll have the opportunity to self-select which breakout room you'd like to join. We'll have about 10 minutes for each room, and we'll invite you to discuss your role, what organization you're a part of, and any areas that are within your control that you would like to incorporate some of these ideas from this theme as action steps as you continue in your work. Or if you don't necessarily want to focus on your organization or your role, you could consider just discussing what King County could do at large in terms of these themes and activities and next steps. There will be a staff person from Communities Count joining each breakout room simply to help take notes so that when we come back and share as a larger group, we have some of that documentation, but also because as a Communities Count team, we were really trying to build these series of workshops. Your continued feedback and engagement and ideas are things that we want to continue sharing back out with others and building this repertoire of information and ideas that we can include within future workshops and data support and capacity building as well. And then when we come back, we'll have some time to just discuss, and I will share at that time a survey feedback evaluation form. So before Wendy opens up breakout rooms for each of you to join, I wanted to pause and see if there are any questions about the presentation as a whole up to this point, or just around the logistics for self-selecting a breakout room. All right, I'm not seeing any questions through chat. I'm wondering, Sarah J, would you, before Wendy opens up the breakout rooms, would you like to give a quick overview of what participants can expect in terms of identifying which room they would like to join?
Yeah, so this being able to select your own breakout room is kind of new to us and might be new to many of you. So what you will need to do once Wendy opens the room is you should see a series of icons along the bottom of your Zoom screen, things like chat or reactions. And one of those will be breakout rooms. And if you click that, you will see a list of the breakout rooms when they are open. Again, I don't think Wendy's opened them yet, but you should see a list and be able to click join. Now, if this causes you any issues, if that's not working well for you, definitely feel free to come off mute and let us know which room you'd like to be in. Or if you just want to be randomly assigned, let us know and we'll be happy to put you in a room. You can also just type into the chat if you're having any issues and we can put you into a room that way as well.
Okay, I'm gonna go ahead and open the rooms, if that sounds good. And as Sarah J said, if anyone has any trouble, just say or pop in the chat what room you'd like to be in.
All right, I think I'm gonna head over.
Yeah, team, should we join our rooms?
Joey, you and I'll just stick around.
That's what I figured. I'm just giving it some time just to see.
Yeah.
Well, looks like everybody joined a room except for the
Mhm.
two that we were going to take notes
Yeah,
for. So I think we
and
can either,
that's okay.
yeah, I think I'm cool with just hanging out in this room because I don't want to
Yeah.
overwhelm with too many county folks
Yeah.
in any other rooms.
Okay. I'm very pleasantly surprised that everyone made their way to their own room themselves.
Oh, I
know.
moved a couple people because they weren't moving. Yeah,
Good
I moved like two people. They were both on the phone, so I was thinking like maybe via phone they can't.
Oh yeah.
There might be some issues, so I just like randomly selected 2 rooms.
But still, even to have to manually move only 2 people is pretty good.
That's pretty good, yeah. And we lost a couple people like right after our last slide, I think, which is fine because I think generally that's when people log off anyway.
Yep.
Some people get nervous when they're asked.
Yeah.
Yeah.
That's a good point. I do want to join just to listen, but I don't want to, like, I'm really interested in the community-based participatory one, but I'm like, I don't want to overwhelm people.
I think I could join if you wanted to
Yeah.
listen in.
No, just drop in. I'll be back.
Okay.
Yeah, I'm interested to see what people say. I really enjoyed this talk, so thank you so much, Joey.
Oh, of course. Thank you so much.
Oh, someone's in the waiting room.
Oh.
Um,
Do you think, I mean, it's kind of like, what do you do at this point? Do you admit them and say we're in breakout rooms?
well, I just met her. We can let her know we're doing this assignment and that we can also send the recording.
Yes, that sounds great.
Hi, Victoria. Can you hear us? If you can, right now we're doing an activity, actually. Folks are in the breakout room. We have finished, I think, most of the presentation portion. People are just discussing some of their ideas. If you're interested in watching the presentation, I think we plan on sending a recording out to the attendees. But otherwise, right now, would you be interested in joining one of the breakout rooms? Oh, I think it looks like she's joining one.
Yeah, I'm not sure. It looks like Victoria, if you're trying to, it looks like you may be either assigned to or trying to join the community-based participatory research breakout room. So hopefully if that is what you're trying to do, let us know if you're having any issues. Otherwise, as Wendy mentioned, we will be sharing the presentation, and you're also welcome to just hang out with us. We have about 4 more minutes left before we're inviting people back to share back with the large group around their discussions.
I'll just hang out with you, thanks. I got my hours confused today. For some previous you said you're recording it, so that's wonderful.
Great.
I can catch up later. And
Yes.
so will you be going at 3:30 or are you stopping at 3?
We are going until 3:30.
Okay.
We might end a bit early, just depending on how much people have to share back. But yeah, you're welcome to hang out with us and hear what folks' discussions are, and then we'll share the presentation with you so that you can listen in for the first half later on.
Thanks. I'm happy to hear that because I got my dates confused or hours confused today. So, okay, I'll hang out and see what comes back, and I'll look forward to seeing the recording when you post it. What email do you have for me? Can you tell?
Oh, I'm wondering, Wendy, are you able to pull that up?
1 second, and let me see what I have for you. Let's stop sharing the screen. Victoria. Victoria, did you sign up as Tori?
Okay, so it went to Tori Cedar.
Tori
Is
Cedar.
that what okay, yeah, that's a good name.
Yeah, tori.cedar@gmail.com. Is that a good email for you?
I have another one that's good too, but it doesn't matter. I check them all.
Okay.
So if I want to change future, I'll let you know. So
Okay.
for now, I'll just hang out and see what the discussion groups say. And when will you be posting the recording, do you know?
Honey, I don't know if you have a time frame in mind. The recording would be ready on my end, probably at the end of the day or early tomorrow. It just needs some time to upload onto the cloud. That's all.
Okay. Wonderful. I'll just hang out and see what comes back from the discussions for now. So thank you.
Yeah.
Hey, Wendy, I just got a message wondering if the one of the breakout rooms can have a little bit extra time. Actually, both of them would like a little bit extra time. Do you want to give like another minute and a half?
Let me see if I can do that.
Yeah, I don't think I don't know if it allows you to.
Yeah, I don't think it'll allow me to do that. They should have an extra minute just because it gives them a minute to return.
Wrap up. Yeah.
I wonder we could also, if everyone comes back, like open the rooms again. It looks like they'd like at least 5 more minutes, which is good.
Yeah,
Having some rich conversation. I'll let them know that we can't close it, but we'll reopen them.
mhm.
Let's see. Yeah.
It does seem like a design flaw.
Yeah, we'll just let folks know when they join us that we'll do 5 more minutes and then come back.
That sounds good.
Hi, everyone. Sorry, we know that 10 minutes can go by really fast and some of you are probably mid-sentence, but we'll do 5 more minutes. So if you want to just select your rooms again, we'll do 5 more minutes and then come back. Sorry about that. We tried to add more time and it didn't work. So 5 more minutes and then we'll come back.
Okay, and change the settings so that when we close it, I'll manually close it. So if
Okay,
they
cool.
5 minutes, that's okay too.
Yeah.
Perfect.
Awesome.
Because we can message them on our side and see after 5 minutes if they still want more time.
Yeah. You could see everyone was like,
yeah,
when they came back.
That's such a good sign though.
It is. It is. Yeah, no, I was like popping into the rooms and there was really some good conversations. So
That's awesome.
Yeah.
I'm looking forward to hearing back.
Me too.
I heard one of the questions was like, are you all going to be offering this again? And I'm like, I'm so happy that people like this. People like this workshop.
Besides people who might want this again, like there were a lot of people who were still on the waiting list.
Yeah. There was a lot of people.
33 people on the waiting list. So
How many?
33.
Oh, wow.
Wow. For like total or like just today it was 33?
Oh, total.
Okay.
Maybe even more actually, but as of last night, there were like 33, 34.
Wow. Oh my goodness.
Not as many for today.
More for the 10th, which I realized. I was like, maybe a lot of people are busy today, but the 10th, there was a longer wait list for the 10th than today.
Yeah, which makes me feel bad. I hope people who say they will come actually come, because
that's what I was thinking. I was looking down at the number and I'm like, this doesn't look like 55. This looks a little less, but.
Well, what's funny is there's exactly 7 people in each of the breakout rooms, which is a good group for discussion. Because I was just going to say we could increase the number of folks for the next workshop.
I think we should,
Yeah, because I think we could up it by like at least 10, just knowing that maybe 40 people will show. I think we got 35 today.
So we had how many people sign up for today, Wendy? 50?
There were 50 people. There were actually a few more than 50 because we released tickets to the 55. First 100 people on the wait list. So there should be like 55-ish.
Yeah. 55, and then there's what, like 10 on the wait list today?
I think about 12.
12, okay.
Yeah. But I'll have to check the Excel and I'll have to do. And then for the June 10th one, it is full with 50 people signed up and the 30 something, like I said, on the wait list. So I can forward invitations to the first 10 people on the wait list if that's helpful.
Okay. Yeah. Should we, I don't know, maybe we can talk about it with the team too, about maybe even increasing that, because if we had 55 plus 12 and 30 something showed up, then maybe we could even up it a little bit more so that we could also offer an invite to the folks that were on the wait list today too.
Yeah.
Maybe we'll just have a bigger presentation instead of having another presentation in like end of June. We can just really open this one up. So I don't know, just a thought, but we'll see. One thing is for sure, that we need more time for the breakout room. So that's something we learned today. So.
Yeah, I'm glad no one's in the other 2 breakout rooms by themselves.
Yeah.
Yeah.
I was taking a look. I was like, well, if no one joins, Joey and I can just hang out here in the main room with Wendy. But we'll see. Should we maybe bring people back?
Yeah, does it sound like the right?
Yeah, I haven't heard from anybody yet. I was thinking, should we give it until like 3:10 at least, so 2 more minutes, and then we can bring them back, and that gives us at least 20 minutes for them to share back out. And for if there's extra time, we can drop that. Well, we'll drop it no matter what, the survey link, and invite them to fill that out
Okay.
while they're on the call. Okay. So yeah, maybe just about 2 more minutes.
Do they get like messages that I send
I can
here?
broadcast.
Okay, yeah, cool. Just let them know 2 more minutes or 1 more minute.
Yeah, 3:10.
Okay, I'm going to close the rooms. And now they have a minute to come back.
Honey, do you have a rough estimate of how long it takes to complete the survey feedback form? Is it about like 5 to 10 minutes?
Maybe, yeah. I
Okay.
don't even think that. I think less than 5,
Okay. Great.
maybe. I don't know. It's been a while. I don't know.
I'll say about 5 minutes. I feel like
Yeah,
that makes it easy for people like, okay, yeah,
yeah.
I have 5 minutes. Great.
We can do it. Yeah, during this time.
All right, welcome back, everybody. We are really excited to hear that there were some good conversations going on in the breakout room. So thank you for all of your patience as you joined us again and then went back to your rooms. We're going to have some time right now for the 3 breakout rooms to share a little bit about the conversations that you discussed. And I'll just pause and see if somebody from breakout room 1 would like to start. And that was the room focusing on community-based participatory research.
I can speak to it. There was a lot of really good conversation within that group. And I think trust was something that came up quite a bit, and the willingness of communities to engage for like fear of retribution or like punitive measures. I think very much something else that came out of that room is don't assume and act instead. And there was a very specific example where there was a plot of land that was given, and the organization thought that like community members would want X. They actually talked and engaged with community members, and they said, no, don't touch the land. We want to keep it to the indigenous people within this space. So bringing in that historical context to like gathering information from different community members.
Great, thank you so much, Vanessa, and for everybody who joined Breakout Room 1 to share a little bit more about your ideas and your feedback. I think as Vanessa, Sarah J, and Mariko had joined each of the breakout rooms, what we'll likely do is take the notes that were really reflective of the discussions and conversations that were had in each room, and then figure out a way to share some of those ideas and feedback with participants who had joined us or in future workshops as well. So we really appreciate it. And I wanted to provide an opportunity for folks in Breakout Room 2 who are talking about approaches to data collection and really holding community knowledge at the same as academic rigor, an opportunity to share just a little overview of some of the discussion items that were reflected in that room.
I can take a first go since I was taking the notes for the group. One of the things that came up was in knowing that data collection really is important, over surveyed communities or constituencies, and really a lot how many communities might be survey fatigued, over surveyed or don't or reluctant to really engage in that type of data collection. So we had some discussion around some strategies that some organizations have used to support that, and so support community data collection, particularly things like some practices that were identified were partnering with trusted organizations in the community and contracting with them to also compensate them for that connection, and that can help with community data collection. Also working with community-based organizations as well, like Coalition of Community Health Boards or another organization that can also provide some of those trusted connections. And another thing we talked about was how CBPR might be one way of actually enhancing and making data collection more meaningful and more relevant for those that we're working with to do research. Another issue that came up with community data collection is that those who are willing to fill out surveys or engage in them often tend to be older adults or whiter, or people that have more time or money. And often some organizations are saying that with some of their data collection efforts, they're not as likely to hear back from younger families, working families, younger people, communities of color, but often those are often the communities that we need to hear from the most to inform a lot of our work. Another kind of issue that came up too is that a lot of data collection isn't well coordinated. And so you're getting different institutions, different providers, different organizations asking for people's time, asking for their information. And that creates a situation where uncoordinated data collection overburdens communities, and particularly those that are experiencing that fatigue. So I thought that was a really interesting discussion that we had, and I think we didn't have enough time to do that, but another to get into it, but another strategy that was also pitched was to use different platforms to collect data on. So whether it's a digital platform, whether it's through things like panels or discussion groups. And another discussion came up about also doing things like mobile devices or phones. And there's some other challenges that folks alluded to with that, but as a way of kind of switching up platforms as a way to help mitigate some of that fatigue too.
Thank you so much, Mariko. It sounds like your breakout room covered a lot of information. I was hearing some similar themes just with the one that Vanessa had done, really around centering community engagement and trust and that relationship building. And I think that has been a theme that we've talked about even in the very beginning of the presentation when Vanessa was talking about the role of data and the role of data and policies and community engagement really being this dynamic relationship across all of this. So everything that you guys have continued to discuss, I think really highlights the importance of that. And then the last breakout room was breakout room 4. So talking about research agendas and really supporting the use of data for anti-racist change in policies, processes, and practices in institutions, and supporting communities in creating those policies. And I wanted to provide an opportunity for a quick debrief from what was shared and discussed at that room.
I would welcome any of the participants to chime in if you would like. If you have anything to add or if I missed anything, but since I took notes, I can start the share out. So we had a really wide ranging conversation, and a few of the things that we covered include often we get kind of a snippet of information with data, or we're looking at like how many members of this community live in this neighborhood, or what's this rate, and how can we change our data collection to go deeper? How deep do we need to go? We got questions about what is King County doing now that we've declared racism as a public health crisis and we have all this data. When is there going to be like a publicly shared plan to act on it? We heard about some challenges pushing back when we use data to focus on racial equity, for example, asking grantees to share information about racial inequities in their applications, how to respond. We get questions about why are we leading with racial equity, concerns about who gets to develop the questions that are used to guide research and data collection. Often it is researchers and not community members. And also concerns about the erasure of Indigenous people in data collection through, small numbers and basically the, continuing effects of genocide experienced by Indigenous people on our continent. So like I said, really wide ranging, but I think those are the things I captured in my notes, and I'd love to hear if other folks want to chime in from our group as well.
Sarah J., you covered all the questions that were asked in our group. Thanks.
Great. Thank you so much, Sarah J. and Marielle, for chiming in as well. Again, sounds like a really rich discussion and a lot of good questions to really have some self-reflection as well as institutions or groups that collect data. How can we hold ourselves accountable and think about next steps and share results, and also engage and communicate more in a kind of this bi-directional manner. And at this point, I did want to make a quick plug that we would love to hear from each of you what you thought about this workshop, what worked well, what we would like to see changed. Again, this is one workshop in a series of 3 where we're really going to focus on the use of data in really discussing racism as a public health crisis. The next workshop in the series will look specifically at COVID-19 data. And then the third workshop will include an opportunity to hear more from different communities about how COVID-19 has impacted and shaped their community and experience as well. I did drop the link to our SurveyMonkey in the chat. So again, it should take 5 minutes or less. We really read each feedback and input from each participant, helps us improve and take into consideration what we should continue doing or change in the future. So we appreciate your responses and candid feedback. With that, I wanted to see if any of my other co-presenters would like to say any final remarks, or if anybody else who has joined us today would like to ask any other questions or end us with any other feedback or input.
This is Fatih. I do have a question. Maybe I was in the first group that talked about trust, and it got me thinking about why is trust such a big issue? Is it specifically as it relates to data collection, or is it a social problem that is deeper than the data collection? And if it is a deeper problem than the data collection itself, how can we as a community get around it? It seems to me there needs to be some kind of re-education on what or reconnection, especially as it relates to the local government and other communities around, on how to build trust in order to facilitate that trust data collection system. Thank you.
Thank you so much for that question. And before I share just some thoughts, I also wanted to invite if any of my other colleagues would like to add any of their thoughts or feedback based on that question as well, or any other participant who is here on the Zoom call.
Thank you, Joey.
Yeah.
Just a really quick question, Mrs. Mariel. And I also put it in the chat box. I'm just wondering because, our group, we had a good number of questions, and I'm sure that probably happened in a number of the other breakout groups. How will those conversations continue? How will answers, if appropriate, be provided back to participants? I think I'd like to get a better understanding of how that, I guess, will look.
Thank you, Marielle. So in response to that question, one of the things that our team is going to do is take those notes, and actually that will be one of the questions that we look at is what are some next steps related to that. I think when we send out the recording and notes to all the participants just as resources, we'd like to propose if anybody else would like to continue having some of those things at future workshops or additional conversations with us about that. The one thing that Communities Count team does want to ensure that everybody is aware of, that not only do we do these workshops to engage and share information with people, but we also welcome anybody to reach out to us via email. We often hold one-on-one consultations or want to provide opportunities for even a cohort of folks who have joined our presentations to continue to engage with us. We often have quarterly user group meetings, and we really have opportunities for people to help us shape what that agenda could look like, or conversations or communities or expertise that we want to really make sure are highlighted in those. So I could see that as one opportunity to continue conversations around this, or even help make connections with other organizations and sectors as well. So I think part of what our role is to really hear from our users and the people in these workshops, and then identify some next steps so where we can continue movement around these things. Mariko, Vanessa, Hani, or Sarah J, would you guys like to add anything else to that?
In addition to Joey, thank you for sharing that. Another thing that we're planning on doing with parts of these conversations and some of these questions is to bring them back to our own internal teams and our colleagues to talk about how we're doing with and creating a more equitable data practice within the county. And so I want folks to know too that these are part of a larger conversation, both internally and externally, that we're having, and that really we are wanting to take a lot of these questions, challenges, and ideas that you all have and bring them back to our colleagues to inform our practice also.
Definitely. Thanks, Mariko. And to just circle back to the first question or comment around trust, I think that is a really important one to bring up, something that our team and kind of the thematic kind of topic that we really wanted to think more so about with this workshop series is trust as well. And I think a lot of that is, of course, really continuing to invest time and resources in engaging with communities and having those conversations. And as we talked about just in one of the breakout rooms that others have posed, really ensuring that communities have a representation and voice in setting some of those strategies or plans or developing questions, really having a voice in elevating what issues are arising in communities, what data is missing that we really need to make sure that we're being intentional about asking questions or seeking ways to really bring those opportunities forward. And as well, even when there's not like quantitative data available, we know that community stories and experiences are really important as well to really help shape the context of a lot of the kind of numerical quantifiable data that we have. So I think that that's continued things that we want to not only share with others, but continue to look at within our own systems and our own work. And I think the great thing about these workshops is that I think one of the initial slides that Vanessa shared is some of the things that we're trying to continue to do on our end based on feedback that we're getting. So we also see this as a way for us not only to have an opportunity to engage with people who attend these workshops, but to look back at our own internal processes. Where can we do better? Where are we falling short? Or where can we share with our colleagues or other institutions or other academic groups, and really continue to not always only have communities raising these, but for us also to be that advocate and work alongside communities and help continue to bring this up and look internally as well. So that's what I wanted to share with that. And others, if you wanted to chime in, feel free to do so. I know that we're just at a minute left in our presentation, but I'll pause momentarily. Go ahead, Vanessa.
Thank you, Joey. And I think, Fatih, you're asking like, why is trust so difficult? And I think trust is difficult, like broadly speaking. We're speaking within the context of data because that is the nature of our work. But as an institution, there's a lot of like distrust, mistrust that like exists within us and like the communities that we serve. And I hope through the presentation by like outlining these different like policies, practices, and procedures, like how that helps to how that kind of like hurts the ability to like develop trust. And just to echo what Joey has already said, us is like being this like data shop or engaging in data. Part of us trying to like rebuild that trust is just having conversations, being transparent about what we can do, but also being transparent about what we can't do, and trying to like move this conversation forward and understanding that there are power asymmetries here, right? Just being within institutions and being within community, but just trying to create space for courageous and open conversations. I think for me is very much like trying to fix that trust in like very little, but I don't know, what happens today might help to build trust in like 2 or 3 years and not necessarily putting like a harsh like timestamp on it as well.
Thank you so much, Vanessa. I know we're at time, so I wanted to hand it back off to Hani, who you helped kind of kick us off with this presentation with any final thoughts or a wrap up for all of us.
Yeah, no, just thank you everyone for joining us. Thank you so much for your contribution and just spending some time with us today. I know that we've sort of outlined some next steps, but we'll be sure to include some of that in the follow-up email. We'll be sharing some of this material. Of course, this workshop was recorded and is being recorded, and we'll make sure to share that as well. And really just to keep in touch with us. So we have our communities count, just our general sort of email on here as well as our website. Our website, you'll find both this, hopefully in the next week, you'll find the material and content for this workshop as well as past workshops. And then there's each of our contact information in case you wanted to follow up with any of us. Please feel free to reach out. We're here to support you through some of this data work. And so we are open and willing to support you in any way that we can. If we don't have the answers, I'm sure we can find the answers. So please feel free to just keep in touch with us. We will be offering a couple of more workshops throughout the year. And so, yeah, just keep in touch and I hope you all are able to enjoy this very nice weather that we've been getting. Be well, take care of yourself, and just thank you so much for joining us today. Bye, everyone.